Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. Guys, today, breaking into a new subject, I'm going to get into diabetic emergencies. And today we're going to go over some words and sort of nomenclature and descriptions about diabetes to kind of help you kind of put things together, right? Um, Before we get into that, of course, I want to mention why this stuff is important. I always tell you this every week. And want to remind you it's not just for exams, right? It's key information to help you pass exams, of course, but it's also there to build your knowledge base, help you make better clinical decisions, and interact with other healthcare professionals and write your reports much more efficiently as well, right? So just keep that in mind, guys. And if anything doesn't click for you during these sessions, if anything doesn't ring true or you're not sure of something, I'm hoping that this is going to motivate you to go ahead and open up your textbook, get a resource guide, Google it, whatever the case may be, to go ahead and figure out and understand the content much more efficiently and much more in depth if that's what you actually need. So let's get into it, guys. What is diabetes, right? Well, pretty much it's a chronic disease of the endocrine system, right? It's caused by a decrease in the secretion or the activity actually of insulin. Okay, diabetics in essence, they don't make enough insulin to regulate the blood sugar, and it can be high or low, right? Too high or too low. And when it ends up being too low, that's when the cells start to starve. Okay, now some of the complications that you might see with diabetes, things like eye disease. You get that diabetic retinopathy, and that causes that bleeding in the vitreous humor. You might not see that too much, but it can be a complication. Kidney disease, you get that nephropathy, which can be abnormal functioning of the kidneys, and that can lead to complete renal failure. And then our nerve disease, right? Patients have diabetes, they have a lot of chronic pain, decreased sensation, especially in lower extremities. And what about the cardiovascular? Well, you get a much more increased risk of cardiovascular disease and emergencies when you are a diabetic, especially at a younger age. It can start more at a younger age, right? So your risk is increased with all that, okay? So those are just some of the kind of quick overview of what diabetes is and some of the complications. And I want to just kind of go over, like I said, some of the things you'll see quite common when we talk about diabetes, okay? Diabetes, okay, just some of the things that you might see. You might hear D50 a lot, right? And that used to be kind of the standard medication that we use in EMS to treat hypoglycemia, right? But nowadays you see people treating hypoglycemia with D10, with D25. Of course, follow your local guidelines and what they say on how to treat those hypoglycemic patients, right? But usually D stands for that dextrose, that sugar, okay? Your finger stick or your blood sugar stick or your blood glucose levels, right? Those are the way that we kind of measure the blood sugar in the blood, right, with a drop of blood, and use the glucometer to get that done. And usually it's done from a finger, okay? Usually the normal range for that is between 70 and 100, depending upon what your medical director or what your protocols say, where they're comfortable at. Sometimes it's as low as 60, okay? Sometimes the high end can be 110, 150, okay? And just like I said, it's a kind of a guide, okay? So whatever your doctor or medical director is comfortable with, but overall the average range is between 70 and 100, okay? Glucose, guys, this is that main nutrient for all your cells. It's transported in the blood, okay? And again, that is that 75 to 100 as well, okay? So this is that main cellular nutrient is when you talk about glucose, okay? Some key elements, again, guys, stuff you're going to want to know, right? DKA, right? That diabetic ketoacidosis, okay? That's a metabolic condition, and it consists of the hyperglycemia, dehydration, and accumulation of ketones and keto acids, okay? When we talk about things like hyperglycemia, that kind of goes with that, right? It's, hyperglycemia is part of the DKA, but that's that elevation where the blood sugar is just above normal, okay? And you're going to get those higher readings with those patients, but they're not going to have things like dehydration going on. You're not going to smell ketones on their breath like that, depending upon how high it is, okay? Now, guys, HHNC, right? That hyperglycemic, hyperosmolar, non-ketonic coma. Now, depending on who you talk to, sometimes it could be HHNK, and they leave the coma out of it. Sometimes it's HHNS, and the coma is replaced with syndrome, depending upon what book you read, okay? But pretty much it all means the same thing. That's where the blood sugar is elevated, but there's no acidosis present, okay? Dehydration, and you get the patient ends up having a altered mental of consciousness as well with these hyperglycemic type patients, these HHNC or NK type patients, okay? And hypoglycemia, we see a lot of that in EMS, right? That's when the sugar drops, usually below 60. They become confused. They can have become diaphoretic, pale, cool, right? These are the patients that need your intervention, and something we can kind of fix pretty quickly out in the field. A lot of these patients, of course, are used to having hypoglycemia. When you bring them around, they don't want to go to the hospital anymore, right? If the emergency is over, you fix them. And of course, you want to follow your local guidelines when it comes to that type of thing. But again, these are the patients that have that low blood sugar. Okay. Now, finally, I'm going to wrap this up. Talk about some of the diabetes and some types of diabetes. Okay. And just keep in mind, guys, insulin is the main driver, right? When we talk about diabetes, right? It gets released in the pancreas. It regulates the blood sugar, stimulates production of glucose transport to facilitate the passage of that glucose into the cell, and to get broken down into energy, right? That the facilitated diffusion, okay? And it also helps breaking down fatty tissue in the body, okay? So just some stuff to kind of keep in mind when thinking about insulin, what it actually does, okay? Because when you talk about type 1 diabetes, right, that requires insulin injections, right? Um, this is what you might see patients that take the Humalog, the Novolog, stuff like that, okay? They need insulin to manage their diabetes. And then the type 2 diabetes are the ones that are non-insulin dependent. Usually medications will do the trick, or a lot of times it could be diet controlled as well, okay? We talk about keto acids, guys, and ketones. Those are formed when the body is metabolizing those fats in that fatty tissue. Okay. Again, that's when you start getting that breath. People, you might see it on low carb diets. A lot of times they have that breath, that ketone breath, and they've been on the diet for a long time. Okay, because that's what's happening, is it's metabolizing that fatty tissue. Okay, the body's burning that fat, right? That's a low carb diet, right? Those keto diets, right? So, and then we got finally, I want to mention this Kussmaul respirations, guys. This is when you get that deep sighing breaths that are helping a diabetic kind of blow off excess CO2, and it helps them lower their levels of acid, right? That ketoacidosis. Okay, so a lot of times you'll see that with patients that are having issues with their sugar when they're unresponsive. Okay, you're not gonna have a conscious patient breathing like this. They're gonna be unconscious when you get patients like this. Okay, all right, guys, that is it for this episode. Sorry about a couple of typos here. I didn't catch those on the original walkthrough and that extra slide that I didn't remove from last week, so I apologize for that. But I'm at work today, believe it or not, so I'm trying to bang this out for you guys while I'm at work before I get a call myself. So, guys, engage with me. Get me on social media, Twitter or Instagram. I'm at EMS Safe on both of those channels. You can get me at the EMS Professional on Facebook. It's facebook.com/the EMS Professional. I'd love to engage with you on these channels. And guys, don't forget, check out the main website, emsseo.com. Get practice exams there, but you can also get a lot of good study help, guys. There's study guides there, there's videos, audios that can help increase your knowledge with presentations and downloads, and even something you can claim, something like the Turbomatic personal hard drive as well. So go to emsseo.com, guys. There's actually a search bar on the site. It's a very large site, lots of content, right? It's always growing, always new stuff getting put out there. but you can do a search in the search bar and try to find something that you need help with in EMS. And of course, if you need help, always contact me. My email, you can send it to me. It's contact@emsofficehours.com, and I'll be more than happy to help you and answer questions that you may have. And of course, if you have a suggestion or a topic you want to see on the Monday Minutes, send me an email to that address as well, and maybe we can go ahead and design and create a quick presentation on the Monday Minutes that you are interested in seeing here on the Monday Minutes episodes. And don't forget, you guys, check out emsofficehours.com, check out the previous episodes, check out the podcast there, and engage with me, guys. Okay, I love to engage with all of my listeners and my followers, and keep the conversation on how we're going to bring EMS and forward and make ourselves better as individual providers as well. All right, guys, that is it for me for EMS Office Hours. I am Jim Hoffman. Stay safe.